Hello, I'm Mrinalini Dey and I'm an academic rheumatology trainee from Liverpool in the UK, and I'm reporting for ACR 2020 for Rheum Now. So today I'd like to highlight one of the abstracts that was presented at the second plenary session on Saturday, and this is abstract 0934, entitled Warfarin Use and Risk of Knee and Hip Replacements, and this was presented by Dr. Priyanka Balal. So I found this particularly interesting, not only as a rheumatologist, but also because I do some general medicine as part of my training. And of course, we see a lot of people who are on anticoagulants of various sorts. But I've never before thought to consider the association between warfarin and osteoarthritis. So this was quite interesting for me. So as the authors tell us, vitamin K deficiency is known to be associated with osteoarthritis, but it's not previously been shown if vitamin K antagonism with warfarin leads to progression of OA. So the authors sought to investigate the association between warfarin use and the risk of hip and knee replacements, which are performed for end-stage osteoarthritis. The authors conducted a nested case control study in the UK Health Improvement Network, or THIN database, which is based on general practice electronic medical records. They included adults aged between 40 and 89, and it was patients who'd been enrolled with a GP for over a year, and they included patients between 2009 and 2018. So the patients also had to have a diagnosis of atrial fibrillation, for which anticoagulation is warranted. And they compared the vitamin K antagonist warfarin with direct oral anticoagulants, or DOACs as they're known. The cases were defined as patients having knee or hip replacements between 2014 and 2018, with controls matched by age and gender. The risk of knee or hip replacement with warfarin use compared to DOAC use was explored using conditional logistic regression. So there was 913 patients included who'd undergone knee or hip replacement, with 3,652 controls. And around 65% of the patients who had undergone joint replacement were on warfarin, with the remaining 35% on DOACs. And there was found to be a significant association between warfarin use and knee or hip replacement. The risk of joint replacement was actually found to increase with duration of warfarin therapy. So osteoarthritis is a highly prevalent condition with quite major impacts on functioning and quality of life. And this work suggests that we need more research in this area, particularly maybe randomized control trials, as suggested by the authors, on the need for vitamin K supplementation in this area. It does also raise the question of whether DOACs would be preferable in patients with osteoarthritis, although it's important to remember, of course, that there are multiple factors to consider, and in some patients, warfarin may be the best or the only option for their anticoagulation. So thank you very much for watching, and thank you for joining me today. Remember, if you'd like to be updated on more of the abstracts from ACR 2020, you can follow me on Twitter at Dr. Mini Dey, or you can follow the Rheum Now Twitter feed. Thank you very much for watching.